So thank you, Dr. Dünner, for selecting the abstract for the plenary session tomorrow, and thank you for your interest. So I'm going to present our work on developing a novel combinatorial CAR T-cell strategy for AML that we call ADGRE2-targeting. And we compare that strategy to CD33 CARs and looking at differential target profiles and efficacy and using advanced preclinical models, including humanized mice. So the part of the research has been supported by Takeda. So AML really has an enormous medical need with currently an overall 5-year survival of approximately 30% in an overall patient population. And even though really allogeneic stem cell transplantation has significantly improved prognosis, there remain concerns about long-term mortality and treatment-related morbidity and mortality. But allotransplant really has shown the potential of T cells to consolidate complete remissions. So, and that's why looking at recent success of CAR T cell therapy in B cell malignancies and myeloma, targeting CD19 and BCMA with the approved products, really has fostered a lot of interest in applying CAR T cells also in AML. But when you look at, do you see my pointer? Yeah. When you look at the target profiles with CD19 and BCMA targeting, you get an expected on-target toxicity resulting in B-cell plasma cell depletion. However, in AML, it's a completely different picture. So we target CD33, CD123, CLEC12A most commonly. And based on preclinical studies and early clinical results, it's really associated with a different on-target toxicity spectrum, and that is mostly resulting in either complete bone marrow aplasia or neutropenia, and both of which are clinically less easily manageable as compared to the on-target toxicities found with the currently approved products in B-cell malignancies. So the challenge is how do we achieve selective and efficient AML targeting? And our group in the past has really focused on applying novel next-generation multi-targeted cooperative CAR strategies to better exploit therapeutic windows. And in the session tomorrow, I'm going to explain more in detail, but here's a brief summary of how we think about this. So we started doing extensive profiling of several candidate CAR targets in a relatively larger cohort of 40 relapsed refractory AML patients, and comparing to the expression of the candidate CAR targets also in normal donor bone marrow. And here we looked at antigen distribution and antigen density, knowing that CAR target density is really becoming a very obvious determinant of CAR T-cell efficacy, and we gain increasing understanding in minimum requirements of densities. So in that analysis, we identified ADGRE2 and CLEC12A as two targets that are a promising target pair for combinatorial CARs in AML. And in the past, we've presented at conferences on our new targeted therapy called ADCLEC.syn1, which combines two chimeric receptors. One is an ADGRE2-1XX-CAR that kills independently ADGRE2 high cells, mostly AML. But we co-express a second molecule that's a chimeric costimulatory receptor. So that's not a full CAR, and it doesn't trigger killing on its own, but it increases avidity and provides co-stimulation. So in a way, that molecule assists the CAR in killing ADGRE2 low AML cells that also express CLEC12A. And I'm going to go more in detail tomorrow, but effectively with that, we hope that we avoid antigen low escape but we still maintain an and safety profile that is acceptable. So what we'll present is the expression data showing that ADGRE2 CLEC12A is a promising target pair, and then we apply our therapy in preclinical in vivo models where we see that the CCR indeed in vivo enhances sensitivity in AML antigen escape models. It induces remissions in patient-derived xenograft models, including one that is refractory to a 33 CAR. And it also importantly maintains efficacy in a humanized mouse model where we find bystander normal myeloid cells also expressing CAR targets. And most importantly, in those models we found that ADGRE2-targeting did not deplete the normal HSPC fraction, which is an important safety signal from those preclinical studies. So I'm going to show more of the results tomorrow, but in conclusion, ADGRE2-targeting is really the first, to our knowledge, ADGRE2-targeted cancer therapy. It utilizes an ADGRE2-1XX CAR and is assisted by a CLEC12A chimeric costimulatory receptor. It effectively eradicates CD33 CAR refractory AML in a PDX model. In vivo, it minimizes antigen low escape, and it also comes with tolerable on-target HSPC toxicity in the preclinical model. We also found that it maintains in vivo efficacy in a humanized environment, and we are excited that we'll start testing this first in human in a phase 1 clinical trial for relapsed refractory AML at MSK later this year.